Hey everybody, I'm Nikki and you're watching Backyard Politics. This video goes out to all of the people that have called me a conspiracy theorist or have given me shit about questioning people of power. So whenever I question anybody other than the town moron, I guess, Trump, I get a lot of shit from it, especially from the neolibs, especially on Facebook. So, this new video just came out of Dr. Fauci lying to the general public, telling them not to wear masks, and then saying, oh shit, I guess you should have. Take a look.
Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks. The reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed. So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that that would deter away from the people who really needed it. Now, when you see people and look at the films in China and...
So, he lied. How are we supposed to trust him now? He lied to us saying we shouldn't wear masks. And then a lot of the idiots didn't wear masks, or a lot of the people that fell for the mainstream media didn't wear masks. And we had a lot more deaths because of it. So, on that note, thanks to 206 War Eagle for commenting on one of my recent videos. I hadn't heard of this, and it says Oregon uses coronavirus data to make decisions about reopening. It refuses to release that data. I have to tell you right off the bat, there's this woman in town who is looking for national attention. The woman's name is Lindsey Graham, and she owns Glamour Salon here in Salem. She's the one that put out on Twitter a call to arms to the alt-right, basically, to protect downtown Salem from Antifa. They're just a bunch of posers, and they want national attention for it. So, before the Black Lives Matter protests, Lindsey Graham was also down, in downtown Salem, and she reopened her shop and got in trouble by the governor because we weren't supposed to be reopening anything yet. So she's made headlines over and over and over for this kind of shit, and she never gets in trouble for anything. They did like some bullshit investigation with her kids. I think maybe she got fined, but she's benefiting from this shit more than it's costing her. She has multiple GoFundMes right now that people are actually donating to. This bitch is insane, and I have a feeling that it is tied to why they're not releasing the data and wanting to push for reopening, because capitalism, okay? The Oregon Health Authority on Wednesday refused to release key statistics used to help justify and monitor Oregon counties allowed to reopen during the coronavirus pandemic. The Oregonian/Oregon Live filed 2 public records requests last month seeking underlying data used by public health officials and Governor Kate Brown's office to allow phased reopenings by counties. State officials cited broad discretionary powers given to them by the legislature in choosing not to release the figures. The Oregon Health Authority has frequently cited the law ORS 433-008 for refusing to disclose information related to the pandemic. The law essentially exempts information collected by the agency during public health investigations from public disclosure requirements, giving state or county health officials sole authority to determine what data to release and when. The state health authority has withheld statistics even in instances where counties have released the same type of data. It's part of a broader pattern by state public health officials to limit the flow of information about the pandemic. Although Oregon has one of the lowest infection and death rates in the country, state officials have been secretive on many fronts, initially refusing to release details about outbreaks at long-term care facilities or workplaces or the age ranges for some people infected. They have also blocked the public from listening to daily conference calls between state administrators and lawmakers. In the latest episode, the newsroom sought daily hospital admission tallies from Marion and Polk County residents. For those of you who don't know where Marion and Polk County are, it's basically Salem-Keizer area, so where I'm at, and then also a little bit in the Independence area. Excuse me. Those are two sets of figures cited by state officials May 14th for initially refusing to allow those counties to reopen. Oregon Health Authority officials initially said new hospitalizations among residents had increased, leaving those two counties unable to meet the necessary criteria. But Brown announced the following week that the counties could reopen. Public health officials said new hospitalizations decreased from 24 for Marion County and 9 for Polk County between April 26th and May 9th to 14th, and 6 between May 4th through May 17th. The health authority won't publicly release daily tallies of new county hospitalizations, however, saying it could lead to the infection of someone with the coronavirus. Yet at least two counties have publicly disclosed new daily hospital admissions. Clackamas County released the data in its application to Brown seeking to reopen, and Washington County now posts the information on its website daily. You can see it here. We can't control how other jurisdictions use the data, Rob Cowie, a spokesman for the Oregon Health Authority, said in an email, but we are responsible for how we handle it. Our public health officials are extremely sensitive to the release of public health investigation data out of concern that any disclosure, particularly ones that involve small numbers, could discourage people from cooperating with other investigations in the future. Meanwhile, the Oregon Health Authority on Wednesday separately refused to release the underlying data used to monitor increasing infections tallies by county, a metric that will be considered as officials consider which jurisdictions are allowed to move into phase 2 reopenings. So I'm sorry, but as a Salem resident, I feel like I have the right to know who's infected, where, etc., but also not have like our cell phones tapped or shit like that, right? No invasion of privacy. But they should be releasing how many people in the counties. State officials have built an online dashboard that shows weekly percentage increases or decreases in cases by county. The state set a benchmark that no county should have more than a 5% increase in new infections each week, although officials now say they may not strictly adhere to that before allowing counties to move into phase 2 reopenings. The math behind such percentage increases or decreases should be simple by calculating the sum from 1 week and and comparing it to the previous. But the Oregonian Oregon Live could not replicate the percentages reported on the state dashboard by using the infection statistics released each day by the health authority. Part of the discrepancy could be that the daily totals released by the state include infections and presumptive infections instead of only confirmed infections. As a result, the newsroom requested the underlying weekly case counts used by the state to calculate the percentages listed on its initial dashboard May 21st. State officials refused, saying they plan to eventually make some data available. They eventually plan to make some data available. Aggregated summary tables will be created that will be downloadable, the agency wrote in denying the newsroom's public records request. These take a lot of work and are currently in progress for the Public Health Indicators dashboard. Statewide data will be available for download once those are launched. The health authority has regularly cited the public health investigation law for not disclosing statistics about the outbreak. At the beginning of the pandemic, officials used it to block inquiries about which labs were processing the most coronavirus tests and how many Oregonians had been rejected for testing or were asked to stay home after potential exposure. While the law makes information obtained during public health investigations confidential and exempt from public records disclosure, nothing prevents health officials from publishing statistical compilations and reports relating to reportable disease investigation if the compilations and reports do not identify individual cases or sources of information, just like I was talking about. The newsroom appealed an early public records denial to Oregon Attorney General, but also was denied. In response to the newsroom's appeal for data early in the pandemic, the Attorney General's office wrote, "In conclusion, the legislature entrusted this decision to OHA, and OHA has decided not to publish this data. Although we acknowledge the strong public interest in information about the current outbreak, we have no legal authority to override OHA's decision to withhold the data. OHA is the public health agency in charge and is in the best position to evaluate the wisdom of publishing any particular information." So we know a whole lot of nothing, and we're being lied to. This is why you come to YouTube for your news. Like this video, share it on your social media. It helps the algorithm. It helps more people be aware of what's going on in the area. And hit me up on Twitter at Backyard Politics, Instagram at Backyard Politics Official. You can also email me at backyardpolitics@yahoo.com. Also, visit my Patreon. I'm trying to raise enough money for, one, new lighting, and then also to go to a Portland protest or the Seattle Autonomous Zone. I want to do some reporting up there. So if you can, hit me up on Patreon. You get, or subscribe to my Patreon. You get free behind the scenes, some music stuff, and you can submit articles, etc. I have $1 tier, $3 tier, and a $5 tier. So if you can, please help out. And until next time, Medicare be with you.